All right. Is there one side you prefer that I work on? Both. Okay, so the great thing is the same, right? Same thing. This is a little trickier just because when you pick the knee up, you're extending stuff. So again, take the edge this time and gently lift under the knee, pass it through. I don't really have to lift the leg up hardly. Okay. And then of course, I'm just pulling right towards the head. Right. So in this position now, I can do the tuck if I like. And also, when we get to the glutes, you can easily just roll this back. That makes it a lot easier. So can I tuck this on the side? I'm going to pull this up just a little bit because I do want to get to the ischial tuberosity. Why do I want to get to the ischial tuberosity? Yeah, hamstrings. That's right. Common origin of the hamstrings. And we know that the hamstrings come down this way. And then what do? Yeah, they separate. Which ones are on the medial side? Louder, please. Yep, the semi-sisters, which means that this one is biceps femoris. Those of you that are looking at me like a deer in headlights, get your book out and look at it while we're doing this, okay? Because the semi-sisters do different actions than biceps femoris, and we're going to use those to our advantage, okay? Now, I also want to remind you, the ischial tuberosity is up here. Hamstrings are much smaller than you think they are. They are much narrower. So I'm going to actually show you right now. So Heidi, I'm going to ask you to just hold your leg up here, okay? And then I'm going to press against it, push against my hand. Here are the hamstrings. See how narrow they are? That's it, that wad right there, okay? That's it, thank you. In the book, they look huge, right? They cover the whole posterior leg. They don't. What's on this side? Vastus lateralis. And on this side? Adductors, specifically adductor magnus is going to be there. So this is the only area of hamstrings. And it goes and then splits. Okay. All right. So let's get started here. Way to go. Here. So I'm going to use a little more lotion because it's been really dry. Try to understand. No, not in school. Well, I don't really know that you need to warm up the lotion. Oh, I know this.
Yeah,
it's cryotherapy and it's an added service. All right, so I'm just warming up the posterior leg here. Just general effleurage as we're talking. And I'll focus in to the thigh. I'd like to cover the entire thigh to start. And since my hands are a little bit smaller, I try to use the largest part of my hands to cover more. You do go all the way up to the ischial tuberosity here. pressure okay, Heidi? Can you take a lot of pressure generally? Yeah, yeah. What her pressure is like. So I had mentioned several times about working transverse to the tissue, being able to feel a little bit more. So here I'm doing a circular friction with my palm heel across the hamstrings. And notice my other hand gets to take break. Or you can keep it somewhere. So I'm not feeling any particular adhesions, although when I get down to about here, we start to get a little stuff together. So I'm thinking maybe that's where I'll focus. I can do this to the other side too. Push pull, just kind of like a petricide, but not exactly. And remember, we're still warming up. There's a lot of tissue back here. And when I want to focus in on the hamstrings. So now this is larger tissue, larger area, so I can use my larger tools. Remember the principle, the deeper you go, the slower you go. How's that, Heidi? Couple of passes of forearm. Now I think I'm going to start focusing in. So even though I am going over the adductors here, I'm focusing on the hamstring. Okay. Please, please, please do not get too lateral here. When you get too lateral, you're going to pick bone. Especially in a female, our femurs come down like this at an angle. Okay. So the more lateral you get up in here, you really are on bone. If you would like to palpate just so you can feel that, that's bone right there. Here's hamstrings. Big difference. You can feel it when you palpate. Okay? So again, female femurs come at more of an angle. So just be aware of that, not to work too lateral. Okay. All right. So if I want to focus in on the hamstrings here, I'm going to avoid going up and back and up and back and up and back all the time. Okay. I really want to work more transverse to the tissue. It's a better angle for me. It's more of a direct angle, and I can feel more. I can palpate more. So I did feel that she has a little bit of restriction right in through here. So we're getting close to the myotendinous junction. Yeah, right in there. So I am actually going to set a fist down here. And I'm going to let her body do the work for me. So this is a bit of a pin and stretch here. I'm going to pin the whole muscle down, okay, close to the popliteal space. Okay. And these are the semi-sisters. So what do they do to the bent knee? Yeah, they medially rotate the bent knee. That's right. They medially rotate the flex knee. Okay. So I'm pinning that tissue down. The air, this is what I was a little, yeah. Yeah. For knee replacements, no. That's all I'm doing here. Now I can focus in. Heidi, is this okay for you? All right, so I'm going to use my knuckles and do the same thing. I'm just stepping back and rotating. Just have a screw in the where. You have a screw in it's not the side. I mean, skills. Yeah, I don't think you're not going that far, but in this school, if you rotate it, it's, oh, I'm sorry, ACL, then you, I think this should be fine. But let her do it part of it. I can do the same thing for biceps femoris. Okay. Down. Rotate. And stretch. It's fairly deep. I have my body weight. Okay. And then I'm going to recheck. So, yep. The tendon that was kind of stuck to the other tendon, like the semi-sisters were stuck together, it's freer. I can feel them individually now. Okay, so just that little bit was helpful. And if not, I mean, honestly, you can always come in with an elbow. Just make sure you have your guide hand here because the hamstring is small enough that you can slip on and off medial or lateral side. How does it feel, Heidi? So we can focus on these tendons as well. You were taught not to do anything in the popliteal space. That is true. However, it doesn't say anything about going around the popliteal space. So now that you have more of a tactile sense, your palpation skills are better, you can petrissage around the popliteal space, right on those tendons. It actually feels miraculous. And you can take that then down to the lower leg. It's a nice transition. Ooh. Just remember, when you are working the lower leg more than any other part of the body, you always want to have your pressure go towards the heart. Do you remember why? It's the second heart. Yes. What goes right through the soleus? A what? Uh-huh. Yeah, you have a big vein and a big artery. Yeah, right in the middle there. Exactly. Yep. So you can come back down. You know, you can do all kinds of strokes inferiorly, but the pressure strokes must go towards the heart. Some lovely spreading, lifting, spreading, lifting, and there's a lot of gastroc here, right? Yeah. So when you're working gastrocnemius, typically what you run into is one side, like one head of gastroc will be a little tighter than the other. Have you experienced this with your clients? Like yep. The lateral head is a little bit tighter on Heidi, and I can tell because this side lets me right in whenever I push. This side does not. Okay. So I know where I want to focus because my fingers have been assessing. The other area that can be really hypertonic and prone to trigger points is right here at the myotendinous junction. So you've got this big Achilles tendon that goes into muscle right about here. And that spot and just a little bit higher tend to be trigger point territory. So when you're working deeply in this area, folks, just be aware that that is a prime spot for trigger points. Do you feel anything in that area? Yep, okay. Just nodding before I ask the question. That's fine. So for Heidi, what I want to do is come in a little bit more on the lateral head here. And you see what I did with her little leg? Instead of medially rotating, I laterally rotated. Now her knee is fine. Again, it's not really moving a whole lot, and her hip's not moving a whole lot. And I can use my forearm. If rod or tools are best to start, because this can be very tender down. How's the pressure so far? May I go a little deeper? So that's another thing that I haven't actually explicitly told you all yet, because we're in class and it's implied, but you do need to ask consent before going deeper. Just because somebody has a tight area doesn't mean they want your elbow. And in class, we do it because we're in class and we're supposed to. Now, I am using my thumbs more as an assessment. I'm trying to find the locus of right about there. Yeah. This is where the tissue doesn't give. Okay. And I use my thumbs just a little bit in through here. Okay. So what I'm going to do now is I'm going to do my deepest pressure and my slowest. So I have my knuckles, and Heidi, you let me know if this is too much for you. And I'm not using all my body weight. I don't know if you could tell, I'm kind of reserving. I'm standing up a little bit more. That's still okay? I'm watching her back to make sure that she's not lying to me and she's actually breathing. Right in there. It's pushing me back a little bit. So I am watching her, making sure she is still breathing. Remember, molasses on a cold day slow. And you never go right back into it. Retest. A little softer. I could probably do that one more time. 3 times might be a little much. You can use an elbow. So like she had a trigger point right in here. I can come in, elbow. However, this moves a lot. So you really have to stabilize this area. Alternatively, if you note that soleus is more of the issue, like you can really feel the hypertonicity down here rather than up here, we have another way to address this. And normally you don't sit on the table with a client, but in this case, we'll make an exception because in this position, gastrocnemius falls towards the table and disengages. Okay. And on the lateral side, it's peroneals. On the medial side, it's going to be soleus. So this is where we will get soleus. Okay. So all we really want to do here, interlace our fingers and just push our 2 palms together. Okay. Can wait for softening, or we can turn this into a move and move it and work towards the knee. Is that okay, Heidi? How does that feel? It doesn't feel too intense, right? Because it's a flat. And of course, we don't need to go all the way to the knee because soleus doesn't go all the way. Right? It doesn't cross the knee. If we did need to make this a little more intense, knuckles right on the medial side of the tibia here, hand on the other side, and we're just pushing straight in. Okay, so this hand is bolstering. That's a little more intense because it's knuckles. You can move this one. Okay. Is that okay? I keep checking in because these areas are really, these can be really tender, really bitey, kind of like the forearm. Just move it along very slowly. Do all kinds of stuff in this position. Those are just a couple of things that I wanted to show you. And do. And last but not least, the Achilles tendon itself. So remember, you have Golgi tendon organs that are within the tendon. Okay, and we can, since we're doing neuromuscular therapy, we might as well work with your nervous system. So if we do a push-pull here, so you're pushing with one finger or pulling with one finger, pushing with the opposite. This is a tendon release technique. And then you switch. Push-pull. Activates your Golgi tendon organs. And they send a signal to your brain to reset the rest. One of those pro tip things. Push-pull. Mm-hmm. Yep.
And you do it the other side.
And then you do it the opposite direction. Yep. You'd only need to do it once each way. I'm just doing it because I'm standing here. And I don't stand still very well here. If you're doing some really intense back work, you definitely want to get that fixed. And if you have someone who has a very hypertonic psoas, like it's very, very tight, very hard, you wouldn't even do this in this position. You would have them supine in that figure 4 and get it from an anterior. We'll finish up here. Remember, you have to make notes. Same thing, you just gently lift the knee just for a second. Pull straight down. Notice I never took my hands off. Just have my hands on. Stage it and go to the. Okay.